As compared to arteries, veins are 8 times more extensible than arteries. Why? Because another function of your veins is actually to store blood that is ready to go back into the heart. Why does it need to store blood? Because remember that I mentioned this just a few minutes ago, that the amount of blood that is pumped out of your heart is the amount of blood your body needs. So if your body does not need too much blood, some of it will actually be stored in the veins, ready to go back to the heart when needed. So not all the blood from the veins will actually go back to the heart. Only what is needed will go back to the heart. The rest of your blood will just stay within the veins until it is needed. So there you go. It transports blood towards the heart, and you all know this, it carries that oxygen in the blood. Note that for great veins, there are no valves. Your vena cavae actually have no valves. And they are easily distended. In that series I told you about Monday mornings, there was one patient that jumped off the roof of the building, fell, and was brought to the ER. When the trauma surgeons looked at him, they saw that the superior and the inferior vena cavae were all ripped to shreds. Why? Because of the pressure of the fall, the great veins are easily distended. They are very, very prone to mechanical injury as well. Now the venules will also have no valves. Remember, your venules are your collecting veins. They have no valves, but their walls are slightly thicker than your capillaries. Right? Please note the difference that the great veins and the venules are the exception to the rule. They have no valves. Conversely, do you recall when we talk about the cardiac cycle, what is the pressure inside the right atrium? How many millimeters mercury? 40 to 60 is the pressure in the right ventricle. It has to push against the pulmonary valve, right? Pulmonary valve. How about the pressure in the right atrium? I mentioned it, I'm sure. 8 to 12. Okay, just to avoid any confusion, please take note that the pressure in your right atrium is actually 0. It is 0 millimeters of mercury. This 0 millimeters mercury is what you call your central venous pressure. Okay, your CVP. Your central venous pressure normally should be 0. It is the central venous pressure that allows the blood to flow into the right atrium from the great veins. Right. Now, this diagram, I'll be providing this as a handout later on the site. This diagram will show you the different types of arteries and veins. It also shows you the thickness of the walls and the composition of the walls. Note that for elastic artery, there is a lot of elastic tissue which is defined here in blue. This is elastic tissue. Okay, and for your arterioles, there is little elastic tissue, also very little smooth muscles as well. For capillaries, take note, there is no elastic tissue and no smooth muscles in your capillary. In your veins, there are some elastic tissue, but not that much, but there are also smooth muscles in your veins. So this is a comparison chart of the different veins in the arteries. You guys still okay? Right. Let's go to the basic theory of circulation or circulatory function. This is what I've been telling you for the last few minutes. The rate of blood flow to each tissue is almost always precisely controlled in relation to the tissue's needs. So if your tissue needs more oxygen, then more blood will start to be pumped out by your heart. But if your tissue at rest needs less oxygen, then your heart will pump out less. So note that cardiac output is controlled mainly by the sum of the local tissue flows. So your cardiac output, alright? If you look at the local tissues, we're talking about the blood vessels in your GIT, in your renal system, in your skin, in your muscles, the sum of that equals the cardiac output. Just please take note of that. That when blood is pumped out of your heart, it goes somewhere. It is needed somewhere. Pump blood. You know, the way that the body works is, I will never produce, or the body will never produce anything extra. Everything the body produces is sufficient to sustain life. Because if it's over, right? If the body produces too much blood, what will happen? You'll have hypertension, right? Remember what I told you? Volume overload. So if the heart is pumping out too much blood, it's either you could have hypertension or you could have disseminated intravascular coagulation. Why? Because too much blood in your arteries will cause your blood to slow down. Right? Why? We'll talk about this later. But blood is, what's the characteristic of blood? Yes, very good. Viscous or viscosity. Because of the viscosity of blood, the more blood you have in an artery, the more viscous it will become. The more viscous your blood is, the slower it will flow. And that is what we call stasis. Very good. Okay? So now you see the relation of the virtuous triad. Okay? So that's the reason why your body must only produce what is sufficient to keep you alive. And most of you look like you're already dead. Right? Did you not get enough sleep? You were studying for biochem last time, right? Okay, understandable. In general, arterial blood pressure is controlled independently of either local blood flow or cardiac output control. What do we mean by local blood flow? Vasoconstriction and vasodilation is what we call local blood flow control. What is cardiac output control? Your sympathetic and your parasympathetic response will control your cardiac output as well. So, looking at the structural differences of your various blood vessels, note that these are the lumen diameters and the wall thickness. What do I mean by lumen diameter? Lumen diameter refers to the inner part of your blood vessel. That is your lumen. So your blood vessel, remember, is composed of tissues here. Your intima, tunica intima is your inner lining. And then you'll have your elastic and your smooth muscles outside. Now, this area inside is called your lumen. Oh, sorry, yeah. Okay, yeah, that's right. Yeah, this is what you call your lumen. Now, this is what you call your wall. So this is your blood vessel wall, and the inside is your lumen. So take note that your lumen diameter for the aorta is 2.5 centimeters, while the thickness of your aorta is 2 millimeters. So technically, if you look at it, the aorta is actually a very strong blood vessel, right? Because of a thick wall. But remember, it is highly elastic, which makes it prone to what condition? Aneurysm. Okay, so only 1/4 of the class is still alive. Now, going back. So, again, noting, now there's also something I